Ever wondered if there's a way to truly relieve chronic pain without invasive procedures or prolonged medications? Join me as I guide you through what to expect when getting regenerative therapy. Hi, I'm Dr. Mark Petropoli, otherwise known as Dr. P. Got a problem with your knee or any other joint? Call Dr. P. We're delving into the transformative world of regenerative therapy for knees. In a nutshell, it's like giving your body a powerful boost to kickstart its own repair mechanisms. We'll be exploring the step-by-step process of regenerative therapy. Recent research shows that this therapy significantly alleviates knee pain over the mid to long term, offering sustained relief beyond immediate treatment. But what about the cost? We will also take a look at that part. And finally, who's an ideal candidate for knee regenerative therapy? I won't take this long, so let's start. Does regenerative therapy work for knees? Regenerative therapy uses the body's natural healing power to fix and slow down the wear and tear of tissues, like cartilage, by introducing special cells where they're needed. It's like giving the body a boost to repair itself. Numerous studies have found that regenerative therapy enhances knee arthritis symptoms. This therapy for knees typically involves the following steps. Number one, harvesting. So particular cells could be obtained from various sources such as bone marrow, adipose tissue, and otherwise known as fat actually, or from donated cells such as placenta cells or umbilical cord blood. However, donated cells are not allowed by the FDA in the United States currently. I also worry about going to other countries and the potential for lack of regulation, abuse, and potential complications while overseas. In the case of knee issues, we usually utilize the patient's own cells from their bone marrow. Remember, the cells do the work. That is why cell-based therapies work so much better than artificial drugs or even quote-unquote just PRP that has growth factors that stimulate our cells. The cells do the work, not the growth factors. Processing. The collected sample is processed to isolate and concentrate. This step is crucial for obtaining a sufficient number of potent cells. Administration. The concentrated cells are then injected directly into the affected knee joint. These cells may have anti-inflammatory properties, helping to reduce inflammation in the knee joint associated with conditions such as osteoarthritis, which is inflammation of a joint. Stimulation. These cells can stimulate the resident cells in the joint to proliferate and contribute to the healing process. In other words, the bone marrow cells can actually influence other cells and tell them what to do. The bone marrow cells can also have anti-inflammatory properties, helping to reduce inflammation in the knee joint associated with conditions like osteoarthritis. What is the success rate of knee regenerative therapy? Research indicates that compared to placebo, which is basically nothing, knee regenerative therapy significantly alleviated pain at the 3-month, 6-month, and 12-month marks post-treatment, suggesting sustained and meaningful pain relief over the examined period. There are also studies that show sustained relief for years as opposed to weeks or months with standard treatments such as PRP and hyaluronic acid injections, which are the typical quote-unquote gel injections. Our experience has been the same, and we're participating with the Data Biologics Registry to better track our results as well as compared to the results from around the rest of the country and the world. These findings underscore the potential efficacy or effectiveness of the therapy in providing lasting pain relief beyond immediate treatment. So how much does regenerative therapy cost? The expense of regenerative therapy exhibits considerable variability influenced by factors like the specific type, quality, and quantity of cells used, as well as the location and source of the cells. Typically, however, the overall cost can usually span a broad range averaging between $5,000 and $50,000, emphasizing the importance of understanding the intricacies of the treatment and considering individual factors that contribute to the pricing variation. Potential patients should inquire about detailed breakdown of costs, including laboratory fees and other associated expenses, and carefully evaluate the reputation and qualifications of the healthcare provider or clinic that's offering this therapy. Who is a candidate for regenerative medicine? If you experience chronic pain, you may be a suitable candidate for regenerative therapy, but its applicability extends beyond chronic pain alone. Individuals with diverse medical conditions, including osteoarthritis, characterized by joint cartilage deterioration and associated pain, can benefit from this form of treatment. Studies have demonstrated that regenerative therapy has the potential to alleviate midterm osteoarthritis pain while also acting as a natural anti-inflammatory agent. This provides a holistic approach to managing certain health conditions. If you heard about regenerative therapy but are unsure where to get them, look no further. Our team, with years of experience, have helped countless patients find relief from their pain and return to their active lifestyles. We've been performing PRP since 2008 and the bone marrow aspirate cells since 2017. And since about 2020, we've been combining these and doing various synergistic programs, which we found tend to last longer and are more effective. So in summary, regenerative therapy for knees harnesses the body's innate healing abilities to address issues like cartilage wear and tear. The process involves harvesting cells, often from the patient's own body, at least in the United States, processing them to concentrate their potency, and then administering them directly into the affected knee joint. Research suggests that there is a significant and lasting reduction in pain, emphasizing the therapy's potential efficacy over time, long-lasting. Regenerative therapy is not exclusive to chronic pain, but extends to conditions like osteoarthritis, showcasing its holistic approach in alleviating midterm pain and serving as a natural anti-inflammatory agent. Join me as we delve deeper into cutting-edge regenerative solutions for knee problems, exploring the latest breakthroughs and expert insights that could transform the way we approach joint health. Don't miss out. Subscribe now and empower yourself on the journey to healthier knees.